Self-advocating, or speaking up for oneself, is something that's vitally important for those who live with neuromuscular disease, particularly to ensure that they get the appropriate care for respiratory involvement, for underventilation, and or cough insufficiency. An example might be when you begin to experience some symptoms that your breathing is affected by your neuromuscular disease. This is an occasion where you would need to self-advocate, try to get an appointment with a provider who specializes in the breathing issues of those with neuromuscular disease. Another occasion might occur, maybe perhaps after you've already done that, and you get your ventilation device, your BiPAP or your bi-level ventilator, and the settings just don't feel quite right. So that again is another occasion where the burden is on you, so to speak up and tell that individual that was responsible for setting up those settings that maybe something needs to be changed. Also, too, our settings very often need to be changed over time. Not necessarily very often, but a lot of us find that at least once a year, sometimes we can go a little bit longer, but those settings need to be changed. And so again, that's another scenario where maybe it's not time for you to be seen by your physician, but you could reach out to them by calling the office, calling the doctor's nurse, or sending an email. Maybe this practice has a patient portal and you could reach out to them again. Again, exercising your self-advocacy skills. Another common scenario where this comes in handy is, for example, if you are experiencing some symptoms during the day and they've made changes to your nighttime ventilation settings and those symptoms are continuing. And if you're on non-invasive ventilation, then this might be an opportunity for you to ask about potentially using some ventilation assistance during the day, maybe in the form of mouthpiece ventilation or SIP ventilation, as it's very commonly called. But again, it's dependent on you to speak up, to advocate for yourself, to let your provider know that you need some help or that maybe something might be of benefit to you. Another good example of this is maybe you're finding that it's difficult to cough. You have a weak and or ineffective cough. Sometimes that's termed cough insufficiency for those of us living with neuromuscular disease. In that case, it would be a great opportunity for you to speak up and ask if there might be a respiratory muscle aid, maybe mechanically assisted cough, a device that you could use to help with that. So in closing, I just want to encourage you to exercise those self-advocacy skills. I know sometimes it can be tough. It can feel a little outside of your comfort zone, but once you begin to self-advocate and you see how effective that it can be, then I think you'll realize that it's just the thing to do and that it's for your best interest. And that's what we want. Of course, if you have any questions about any specific scenarios that self-advocacy might come in handy for, feel free to reach out to Breathe with MD, our organization, or feel free to connect with your peers through the Breathe with MD support group that our organization administers.